I'm Julia Corvetto. I am from Brazil originally, but I've been here in Heidelberg at the Heidelberg Institute of Global Health since 3 years approximately, where I studied my doctoral research, my doctoral studies on the intersection between climate change, more specifically heat, on mental health. And by training, I'm a physician. I always liked these two topics, climate change and mental health, but they were always in parallel in my life. As I said, I'm a physician, so during these medical studies, I wanted to go for psychiatry. And climate change was also in my daily routine. I was worried about how climate was changing. Of course, Brazil is very warm. I come from a very warm city, hot. Only later, in the end of my medical studies, I discovered that there is an intersection between these two topics, climate change and health overall. And opening a parenthesis, we already understand now how big the lack of knowledge among health professionals actually is. That's exactly when I started my doctoral studies on the topic. The inequality comes in when we think that those contributing the least to climate change are exactly those bearing the biggest burden. I've worked with real data world from Brazil, and why then climate change or heat affects mental health patients. Climate change and all its variables, extreme weather events such as floods and droughts, and also heat, impact not only physical, but also mental health. And mental health is the least studied health area in this intersection. This per se is already very important. And also we are talking here about a highly prevalent condition. For example, in 2021, the prevalence of mental health disorders in the world was almost 14%, which is already a considerable number. But some countries bear even a higher number, a higher prevalence, for example, which is the case of Brazil, which reaches almost 20% of prevalence, meaning that a great number of patients will be vulnerable to feeling the impacts of climate change. I had access in my research to over 100,000 emergency visits of patients with some kind of mental health disorder. We did find that these patients had 15% higher risk of seeking emergency care after exposure to extreme heat. And this risk didn't only occur on the next day or on the very day of exposure. It was delayed until 1 week after the exposure. So it is very important also for the healthcare professionals who need to prepare and receive these patients, right? So some subgroups were particularly affected. For example, neurotic disorders, mostly anxiety, and also those patients who had attempted suicide. In this last subgroup that I mentioned, we found an increased risk of up to 85%, which was the highest effect for the entire study. Why would heat affect then mental health in the first place? What are the mechanisms behind this relationship? Well, first we have to say that the mechanisms are yet to be fully understood. We do know that it's a complex relationship and there are many causes behind it. Maybe I cite the main idea to you today. First, heat causes the imbalance of some neurotransmitters and hormones in the brain, which in turn seems to be responsible for the appearance of the arousal of these acute symptoms in patients, for example, with schizophrenia or bipolar disorder. Besides, heat also affects the sleep quality and pattern, which also seems to be a triggering point for these acute symptoms. Likewise, the cognitive impairment caused by some of the disorders might make that these patients not to act to properly cool their bodies, such as, for example, keeping themselves hydrated or going to cooler areas. The use of some substances, including alcohol or other drugs, and even some psychotropic medications used to treat the mental health disorders, act also as impairing the heat dissipation for these patients. Who is most vulnerable to heat-related mental health issues? Which of these subgroups of mental health disorders are actually heat sensitive? Not all of them are equally heat sensitive, that we must say, but some subgroups are already delineated in the literature or established very clearly. For example, schizophrenia, as I already mentioned, bipolar disorders as well, anxiety, suicide behaviors, both completed or attempted suicide, and organic disorders like dementias, and lastly, substance misuse, either by alcohol or other drugs as well. What about the elderly? Why are they more vulnerable to heat? Elderly are per se a very vulnerable group. The pathways responsible for heat dissipation among these people are already impaired or relatively impaired because of the age. So that means that the core body temperature among these people might increase more easily. Likewise, these patients might have mobility reduction, which impairing the ability to respond to heat, to go to cooler areas, or to keep themselves hydrated. Or also they are more prone to being institutionalized, which was previously correlated to higher risk of negative outcomes. Last but not least, and more like an overarching topic, elderly seem to face higher healthcare access barriers. For example, what happened in 2003 in France during the heat wave there, when thousands of elderly died at home for not being able simply to seek care under extremely high temperatures. Why do many individuals end up not seeking care during heat waves? Why do they face these barriers? So this topic is very relevant in this context of mental health, because then we are not only talking about the socioeconomic related barriers, like lack or high costs of public transportation, for example, or the impossibility of leaving work, the distance, long distance from a healthcare center. These barriers, of course, they exist, but they are overarching in all the health areas. Regarding mental health specifically, we have stigma and mental health literacy, both which play a role. And we do know that patients with lower socioeconomic status and male gender, they both have higher stigma and lower mental health literacy, which prevents them from seeking care. Specifically, in this case of Brazil, public healthcare system is universal and entirely for free for everybody who is inside the territory. Still, if you want a quicker, a better service, you can pay and go to the private sphere. National research showed actually that there is a difference between patients, between the socioeconomic profile. From the public, the socioeconomic profile is lower. They have lower education and lower income. Our research showed that patients from the public sphere, again, who have lower socioeconomic status, had a higher heat vulnerability. However, likewise, they couldn't seek care freely, since they probably faced more healthcare access barriers related to socioeconomic status. On the other hand, patients from the private sphere who have a higher socioeconomic status had a lower heat vulnerability, as probably they had more access to adaptation and measurements at home and at work as well. However, when temperatures got really extreme, probably these measurements, adaptation measurements, were not sufficient anymore. So what happened is that these private patients decided and sought care freely without any access barriers to these healthcare centers. So what kind of interventions or policies could help us now? Our previous studies showed the existence of risk and also the inequity of heat vulnerability and of healthcare access behaviors. This way, we know for sure that there is the need for adaptation actions to reduce the risk of heat on mental health patients. For example, through the implementation of an early warning system that works not only by identifying and informing an upcoming heat wave, but more importantly than that, is that it provides patients, family members, and healthcare professionals with actionable information on how exactly to act to reduce the risk. Of course, there are many other interventions that are very effective as well and should be implemented, not only in Brazil, where this research took place, but worldwide as much as possible. For example, the implementation of cooling centers. So patients can go, not only patients, people in general, heat is a risk factor for everybody, can go to the center during a few minutes are ready to cool their bodies down. Or even simpler than that, planting trees in the city. The greening of cities is a very important tool to reduce the risk of heat on mental health and health in general by reducing stress levels, improving the quality of relaxation of everybody who lives in the city. One thing that policymakers and global health professionals should take away from this work is that, well, we are far from doing enough. Only recently we started to better understand the risks of climate change on mental health. And we, especially mental health professionals, need urgently to incorporate planetary health and climate change topics in our clinical routine, since of course climate change is currently one of the biggest threats to human health. And of course, we need to remember as well that the health sector is per se a perpetrator of climate change, as around 6%, at least in Germany, of the greenhouse gas emissions come from this sector. Well, the next steps right now are basically in the direction of corroborating and deepening the previous results that we had. Integrating, for example, wearable devices that could measure more objectively the impacts of heat on physiological variables on patients with mental health disorders, for example. Likewise, by exploring other sources of data set as well, because we do know that using emergency department visits, as I did before, and other facility based data set is fated to be biased. Because we are only measuring those who, despite all the healthcare access barriers, managed to seek care and were therefore included in this study. but we ended up ignoring a great number of patients who could not reach the healthcare system. Então, antes da gente acabar, eu queria mandar uma mensagem para as pessoas do Brasil que estão, em português, na verdade, a mensagem, que estão lidando com o calor e têm, ao mesmo tempo, um transtorno de saúde mental. Bom, primeiramente, como eu falei anteriormente, o Brasil conta com uma das maiores taxas de transtorno mental do mundo. Eu acredito que agora o mais importante é que não só os pacientes, mas os seus familiares, os cuidadores, os amigos, conheçam e saibam do risco que o calor impõe, para que nesses períodos de calor mais extremo haja uma vigilância ativa dessas pessoas para reduzir a exposição dos pacientes às temperaturas elevadas e para também intensificar as medidas de adaptação nesse período, como maior ingestão de água, de líquidos, banhos mais regulares, evitar a ingestão de bebida alcoólica e outras drogas e tantos outros. E sempre lembrar que a crise climática é questão de saúde pública.